Aims to find solutions to your medical queries. It seeks answers to common health problems that have been hounding you. We will help you out in finding answers to your medical concerns. I'm Angel Jacob, and this is MedTalk, your weekly on-air health consultation here on the Solar News Channel.
Taking a bath, brushing our teeth, and washing our hands are just some of the hygienic practices we do. Unhygienic practices may lead to some health problems. One of the most common hygiene problems is body odor.
Now, body odor is the emission of unpleasant smell. Pero most of the time, it is because of the perspiration and the natural extrusion of some of these chemicals that comes out of our body.
Other hygiene problems can be caused by hormonal changes and lifestyle.
The areas that are important to soap are the ones with apocrine glands. So your underarms, your genitals, because those are the ones that emit a lot more odor. Practice kasi natin talaga wash the hair every day because we're in a tropical country. And of course, our tawas. We let it dissolve in a pail of water and we use it as our final rinsing when we shower, when we bathe.
What bacteria causes body odor? What are the other problems caused by unhygienic practices? Are body odor, bad breath, and smelly feet most common to teenagers? What home remedies can be done to combat these hygiene problems? All these and more tonight on MedTalk.
To help us tonight in our discussion is Dr. Janet C. De Grano, a dermatologist from the Asian Hospital and Medical Center and Daniel Mercado Medical Center. Also joining us is Dr. Elmer Angus, family medicine physician and chairman of the Department of Family and Community Medicine from the Manila Doctors Hospital. You can participate in our discussion by calling our hotline. You can also follow us on Twitter, post on our Facebook page, or send us an email. Good evening, doctors. Welcome to the show.
Good evening.
Tonight, we'll talk about keeping our bodies healthy, free from diseases, at the same time smelling good through proper hygiene.
Yes.
So what is the best way to take care of our skin?
Well, I would say keeping your skin clean, okay? So taking a bath every day, or at least using the right soap, and with proper scrubbing, with proper attention to like the armpit areas or the genital areas, and not overdoing it, like using too many chemicals for the body.
Mm-hmm. Dr. Angus, would you like to add that?
Aside from that, no, we can clean our body through daily bathing, washing, and we can do things that make us more appealing. And then you can use the proper soap, proper cleansing materials, as well as you can use the sponge or anything that are not harsh to the skin. Actually, we have so many materials outside or in our house that we can use. In fact, we can, you know, Filipinos are sometimes inventive, and even in the barrios, in other communities, they have different kinds of ways to help clean the body from head to toe.
So, you mentioned head to toe. We take off from that.
Yes.
Let's start with proper hygiene with our face, our facial hygiene, our hair, our scalp, eyes, nose, mouth, and ears. So briefly, let's give them a little bit of information on all those things.
Okay, so it all starts with using, I believe in using the right soap, okay? So always try to stick to mild soap, okay? Not too harsh, not too smelly, not too much perfume. And as much as possible, we try to use moisturizing soaps, okay? Especially as we grow older, we tend to have drier skin, or if we have skin problems, then we use the the moisturizing kind of soap. Okay, so
In reference
yeah.
to cleaning our face,
Yes,
is there a
okay.
proper way or proper method to use?
to
when
use
we clean our
no,
face?
just not too harsh,
Not too hard.
not too harsh, as in you scratch your face, and then you can wash your face 2 or 3 times a day, or depends on how oily your face is. For some people, they tend to have more oily skin, so they tend to wash more or use a lot of toners or astringents to get rid of the oil on the face.
Okay.
But still, it all boils down to using the right product or the mild products that will not harm your skin.
So if you're normal or normal to dry or oily,
Yes.
you should, or combination.
Yes.
Yes.
Lalo na now, no? It's summer.
Yes,
So we tend to be oilier.
Oilier, sweatier. So,
especially the male.
yes.
Especially the male. Why is that, doctor?
Because males have more hairs. They have a mustache, they have beards, they have what do you call this? Other things. Yung mga dito nila.
The stubbles.
So all
or
these
the-
things will, contribute, especially the hair follicles that will exudes oil and everything, and then with that, they have tendencies to be oily, and if they're exposed to sports,
Yeah, they
then-
also tend to be sweaty, more sweatier than the females.
Females.
So they need to clean their skin more, or at least wash their faces more often, just to keep the dirt away.
Okay. How about in keeping the dirt away from our hair and our scalp? What's the proper hygiene or proper care for our hair and scalp?
Yeah, just daily shampooing the hair will do, and again using the milder shampoos that will not harm the scalp, and also not using too much or too many chemicals for the hair, like too many gels or too much coloring on the hair. So that's also part of the hygiene for the scalp or the hair.
But remember, the youth today are so
Conscious?
conscious.
Yes, they
At
are.
the same time, especially the males, they have
Yes.
this, what we call this, all these things that they place in
Yes.
their hair, to make it stand or what.
For a certain style that they
Yeah.
want to
Yes, mga
achieve.
hairspray, so mga gel. So it can cause additional strain on the scalp, on the hair. So it's better if, at the end of the day, you wash it all off.
Most important to wash it
yes,
off. At the end of like a night out or like a
Yes,
sports activity,
Yes.
of course.
Yes,
Again, proper hygiene is to wash it off.
Before
Yes,
retiring.
always. It's all about washing it properly, washing it all away.
And before we go back to, we've talked about the hair, we've talked about the face, we're going to talk about oral hygiene. But before we do that, we'd like to go to our Facebook question.
Okay.
Since I perspire a lot, is it okay to take a shower more than 3 times a day? Should I worry about pasma?
So it's okay to take a shower as often as 3 times a day, but always remember that when you shower more often, you get rid of a lot of oil from the body, so there will be a tendency to dry the skin more. So if you're the sensitive type, or you have dry skin, or you have atopy, or certain skin problems related to dryness, then bathing more frequently can cause certain problems on the skin. Okay. Now, as to the concept of pasma,
Is there such a thing as pasma?
it's hard to say what pasma really is, but it's a very, very common term for Filipinos.
We get this from our lolas and our
Yes,
Yes,
yes.
our parents.
So not to take a bath when we're tired.
Yes.
Kasi mapapasma.
Or not to wash
So
the
you
face
have-
because our eyes will get pasma.
So you have to spend about 30 minutes before doing this, taking a bath or washing your hands and feet.
So 30 minutes before you take a bath.
Yeah.
So
So
rest
you
your
rest,
feet first,
yes.
rest your skin. Is there such a thing as you take a bath, like the Facebook question, you take a bath 3 times a day, which is okay.
Okay.
Yeah, okay.
Do you need to soap and shampoo every time you take a bath?
I guess it depends on what you want to do. If you really want to cleanse your body, like you just came from a dirty activity or a sweaty, sporty activity, then it's always good to use use soap and shampoo. But but for some people, it's just about cooling the skin.
Yes.
So like my daughter just wets her body and that's it. She goes out of the shower. So it's also hygienic to always use soap, just to get rid of some dirt there and the oil. But basically, it's all about how you want your body to be, how clean your body you want it to be. So
Others are also obsessive compulsive. They can't leave the shower without scrubbing and shampooing their hair properly.
They want it complete.
Yes, head to toe, as you mentioned earlier, Doctor.
Yes.
We have another Facebook question. I use conditioner every day because it smoothens my hair. Does it also contribute to having oily hair?
It depends. If the conditioner that you use is kumbaga hiyang,
Okay.
or it is hiyang to your skin, then it is okay. Anyway, it will just make your hair malambot, which is better, and it will make it easy to comb,
manage.
and manage, and make you well groomed.
Okay. And sometimes, the tendency is to put conditioner and put it right away on your scalp.
yes.
Does that contribute to having oily hair?
Yes, it can contribute to having oily hair. So I was told by a very good cosmetic person before that it's always good to just apply conditioner on the ends,
yes.
not on the, because it can make the roots oilier. So
just apply conditioner on the ends. Be patient, apply it on the ends. Maybe leave it on for a minute or two and then rinse. And then you have smooth, soft, manageable hair. We will talk more about proper hygiene. But we have to go to our Facebook question again first.
Okay.
I sweat a lot, but I'm afraid to use deodorant because it might darken my underarms. Would you recommend tawas instead?
Okay.
Again, another material passed on by our
yes,
grandparents.
yes. Actually,
Parents.
having dark armpit is a very, very common problem. So I see a lot of patients who come into the clinic complaining about their dark armpits. But we should always remember that it's about a lot of things, like not using the right deodorant. Maybe you're using a very harsh ingredient, or you're shaving it too harshly, or plucking it too harshly. And then also comes the genetic factor. So some patients or some people at the age of 9, 10, they already have dark armpits even before they start using deodorant or before they start shaving. So it's a genetic predisposition also. And sometimes it's also very common in heavier persons, in obese persons who tend to have darker flexural areas. So,
And maybe too much, to those who use deodorant already, too much rubbing of
yes.
deodorant. Again, maybe it's the thought that, when you rub the deodorant a lot, that means you're protected from any sweat or smell.
Yes.
Actually, it's adding insult to injury.
Yes. So you're irritating the skin too much, and a common response of the skin is if you irritate it, it darkens. So always, less is better. Okay.
Or talaga maitim na yun.
To begin with, like what you mentioned before you even use deodorant, it's genetics. We'll talk more about proper hygiene and maybe home remedies that they can do when they're faced with problems like this when MedTalk returns.
Did you know that mysophobia is the fear of contamination of germs? Mysophobia was derived from the ancient Greek word mysos, meaning uncleanness.
Ayun. Being too clean. We're back here on MedTalk. I was talking to the doctors earlier, our VTR said uncleanness. And is there such a thing as being too clean?
Yeah, for some people, they tend to scrub so vigorously. They tend to wash their hands, 100 times a day.
Yes.
So this can cause problems because you will dry. You will lose all the natural body oils, and dryness can lead to so many skin problems like itching, like cracks on the skin, and feeling of tightness. So there's no way of getting rid of the dirt except by washing your hand properly with the right soap, but not too much. Just meron kasi yung iba pag nag-shake hands, hugas ng kamay, or
alcohol.
Alcohol, yeah. Sa office, very often ngayon, lahat alcohol ng alcohol. So lahat
Okay ba yun, Doc?
Alcohol can be very irritating.
Or it will make your skin dry.
Drier.
The more
yes.
magiging itchy.
Lalong magda-dry. So especially now yung mga alcohols kasi ang daming scents, ang daming added chemicals, so it can cause secondary allergic reactions.
So we talk about dryness. Let's now go to our oral health or oral care. I speak of dryness kasi now that summer, summer season, sometimes the tendency of our mouth, if we're not able to get access to water, is to dry up. So does that lead to bad hygiene? How do we remedy something like that?
It will lead to halitosis or bad breath.
Bad breath.
Because the mouth is dry, so there's less saliva.
Okay.
So the tendency is for the bacteria to grow, then there'll be a production of bad odor.
But sometimes even if we're hydrated, others complain that there's still a certain smell that comes out of their mouth. Is this genetic? Is it what they eat?
Yes.
Is it an age thing? What could it be?
Okay,
Yes.
so it also depends kung ano yung kinain, so, and not brushing your teeth properly, or leaving some sediments on your tongue. So our dentist always asks us to scrape the tongue or use a tongue scraper every time, especially if you have problems with bad breath. And then flossing can be very important too, so you don't leave any food sediments that can cause bacterial overgrowth on the mouth, in the mouth.
It's a routine, no? Yes, Dr. Angus.
Aside from that, bad breath can also be caused by infections of the sinuses,
Yes.
then tonsils, decayed teeth. It can also be due to colds or some aspects wherein it involves the infections, especially in the gums. And if you have this so-called, it also comes from the stomach.
When you're hungry then, no?
And if you have this so-called GERD, the so-called gastroesophageal reflux disease, you can also have halitosis.
Is eating chewing gum in place of brushing your teeth, flossing, or maybe using a mouthwash when you don't have time to do all the three that I mentioned okay? Gum or candy?
It definitely cannot replace yung brushing the teeth, but I found some gums before that contain some antibacterial agents, or maybe the process of chewing it also cleanses the teeth. Maybe it can help.
But there's nothing like a good old
brushing the
teeth
Yes.
and flossing as well. And tongue cleaner. It's a routine, no? As I said, it's a routine. You have to remember. It's a habit.
Yes.
Yes.
You have to remember when you brush, you floss, you scrape your
The tongue, yes. Or
It's
at
a
least
routine.
brush the tongue.
You have to do it in a routine way because we are creatures of routine.
Yes. So we've tackled facial hygiene. Now we go to our bodies, how to care for our bodies. Like, are there specific areas in the body that need more attention than our other body parts?
I would say it's always the areas that will emit odor. Like, we're very Filipinos are very conscious people, so
Yes.
we all use antiperspirant deodorants to prevent smell from coming out from our armpit. So I think the best parts to concentrate on in cleaning are the armpits, and of course our genital areas, and also our feet. Okay, so most of us tend to have sweaty feet, so it's always good to always have a good feet hygiene. So clean it, soap it every day. Don't reuse your socks, or
Change your socks every day.
Change your socks every day, or if your feet are so sweaty, you can use foot powder, or don't wear shoes that are too tight. So just to prevent the excessive sweating of the feet and accumulation of too much sweat on the webs, which can cause fungal infection.
How about wearing a certain type of material of footwear? Does that contribute to sweaty or smelly feet?
Well, that depends upon the user. If the shoes are okay and it is roomy for his feet, then I think it's a good thing that it can move. At the same time, if he uses the proper socks, usually cotton is good because it can absorb this sweat, not like the nylons. And that is also true to briefs among males. So if you are going to have that, at least the sweating will be lessened. And then it's time for you to change when you go home, and do not use it another day.
Yes. And one good thing pala, just to add, after you shower, always make sure that you dry the webs, you dry your feet really well before putting on your socks and your shoes, because the tendency is, you know, yung mga nagmamadali, bihis agad, nagsasapatos ng basang-basa pa yung paa. So this also predisposes to fungal infection or maceration of the webs, the feet, which can cause a lot of growth. Kasi ang gusto nila yung mga fungi, yung mga mamasa-masa, mga pawis na mga siksik na areas.
How about putting lotion and then you wear your socks?
Lotion?
That's okay.
Yeah, that's
lotion
good.
for your feet.
Yeah.
That's okay.
That's good.
Even if nagmamadali, at least you
Yes,
can. So we've tackled this area, then we went down to this area, now we go up to this area.
Okay.
How about the sensitive part of one's body? How should we take good care of the genital area?
So again,
Let's start with the females.
Let's start with the
So
female.
again, it's just a matter of, you know, washing it properly. Syempre, pag naliligo or after you go to the toilet, it's good to always wash, and always using the milder soaps, not too harsh again. So I guess that's the basic thing that we really need to remember.
What the material for our underwear? Is there a specific type?
For me, it's cotton.
Yeah. Loose, not too tight, not too hugging, just to circulate air, just to prevent too much sweating and overgrowth of, again, fungi.
It's for the females, and for the males?
More or less the same.
Okay.
They have to use cotton briefs, especially to those people that are involved in sports, and to those people who are always sweating. And if ever there is a chance that they can do things in order that they can prevent this kind of situation, at least they will not be able to have these skin diseases like the fungal ones.
Okay. Then we go back to our Facebook question.
Sure.
Doctors, I noticed a foul smell on my navel.
Okay.
What could be the reason for this? You know, sometimes we neglect to take proper care of our navels.
Yes.
Hence our question.
Okay. So we should always remember that not to just clean the armpits, the feet, the navel also. It's a very deep area. So there's a tendency to accumulate dirt, accumulate sweat or oil. So yun, madaling makalimutan. So, and we also have apocrine glands. So that can be causes of too much sweating and production of smell in the navel. So yun, so just daily soaping also of the navel will prevent the smelly problem.
How about putting maybe baby oil or lotion or alcohol and a cotton bud and then cleaning it? Is that advisable?
Yes.
Yes.
Daily?
Daily.
Yes.
Daily, okay.
Especially to those that are navels that are deep.
Yes.
And to those people that are obese, And they have this kind of navel that di na makita minsan.
Okay. So talagang take note to clean it
To
also,
clean it.
to avoid
Yes.
smell, foul smell in the navel.
Okay.
All right, another question from Facebook. What is the best way to teach my child proper hygiene?
Oh, okay.
Nice question.
Ako muna.
Yes.
First
since
of all, the
family
parents should
doctor.
be a role model.
Yes.
And since they're young, they have to continue and start teaching them about hygiene.
At what age?
Children, age 3, 4,
Yeah.
you can do that.
Trainable
And you have to
ages.
train them
Okay.
already.
Yeah.
That's it, because that's the time that the children can recall, remember, and recollect. So that as they grow older, they'll become parang routine na sa kanila. And you will not be able having problems later on because they are already used to this. So the hygienes that you have taught to them, then this will be taking care of them personally, and sometimes hindi na magtatanong sa iyo unless you have some corrections to do.
And so we train them while they're young, trainable age like 3.
Yes, yes.
And hopefully, sometimes when they play outside in the sun, as they get
Yes.
older, they sweat. There's meron ngang tinatawag na amoy grade 1 ka na because your scalp smells
Yes.
because you've been under the sun
Pawis,
for a
yes.
while.
At least hindi amoy lupa.
Anyway, okay. And then at a certain age, when they're teenagers, the smell changes.
Yes.
Yes.
What can contribute or what contributes to the
Kasi,
changes in smell?
Pubertal na.
Yeah, at
Puberty.
puberty, you develop different kinds of hormones. So, nagbabago na yung mga secretion ng hormones. And then, your apocrine glands become more active. So, mas pawisin na yung armpit, yung kilikili, mga genital areas. Tapos, they tend to be more active. So, mas pawis pa rin. So, maraming hormones din na nagkikick in at pubertal age, which can cause a lot of body changes.
So what
So,
tips can you give our teens out there so that they maintain proper hygiene and they are not worried and confident about the sweat that others see?
They have to have the right tools. Ano yung tools na ito? If they need yung deodorant na tama, and then the things that they have to use, shampoo, the gels, and then the proper way of clothing, the proper way to wash themselves and taking a bath.
Yes. At saka yung proper oral hygiene nga, as young as possible, kung kaya ng turuan,
Yeah, oo.
teach them to brush their teeth. So, I see a lot of kids with 2 years old, 3 years, talagang maiitim na yung mga ipin. So, maganda kung maturuan sila ng maaga na mag-toothbrush, not too much sweets or candies, or at the very least, brush their teeth after giving them sweets. Yun.
I have one tip. I always have a toothbrush inside my
Yes.
bag.
Yes.
You travel a lot, so you have to
Yeah,
have
I go. When you meet a lot of people, you
Yeah.
talk to a lot of people, and there's
Yes.
always a bathroom
Yes.
where you can brush your teeth and you
Yes.
can wash your hands.
Yes.
Maybe even take a bath sometimes.
Yes.
Oh.
And
So-
you feel more confident if you know that you're not smelling or you don't have tinga.
Yes,
na
exactly.
And you can function well
Yes.
socially, win friends,
Yes,
and your image is good.
that's right. And you can pass on that tip to others.
Of course.
Diba? So that's just exactly what we did tonight. So I'd like to thank you, doctors, for helping us
You are
understand how to take better care of our skin. Thank you. Thank you once
you
again
also.
to our doctors for enlightening us about tonight's topic, proper hygiene. Once again, thank you to Dr. Janet C. Degrano and Dr. Elmer Angus. See you again next Tuesday on MedTalk as we talk about depression and suicide. 10 p.m. on your scheduled on-air consultation on the Solar News Channel. This is Angel Jacob. Good night.
The natural extrusion of some of these chemicals that comes out of our body.
Other hygiene problems can be caused by hormonal changes and lifestyle.
The areas that are important to soap are the ones with apocrine glands. So your underarms, your genitals, because those are the ones that emit a lot more odor. Practice kasi natin talaga wash the hair every day because we're in a tropical country. And of course, our tawas. We let it dissolve in a pail of water and we use it as our final rinsing when we shower.
Aims to find solutions to your medical queries. It seeks answers to common health problems that have been hounding you. We will help you out in finding answers to your medical concerns. I'm Angel Jacob and this is MedTalk, your weekly on-air health consultation here on the Solar News Channel.
Taking a bath, brushing our teeth, and washing our hands are just some of the hygienic practices we do. Unhygienic practices may lead to some health problems. One of the most common hygiene problems is body odor.
Now, body odor is the emission of unpleasant smell. Pero most of the time, it is because of the perspiration and when we bathe.
What bacteria causes body odor? What are the other problems caused by unhygienic practices? Are body odor, bad breath, and smelly feet most common to teenagers? What home remedies can be done to combat these hygiene problems? All these and more tonight on MedTalk.
To help us tonight in our discussion is Dr. Janet C. Degrano, a dermatologist from the Asian Hospital and Medical Center and Daniel Mercado Medical Center. Also joining us is Dr. Elmer Angus, family medicine physician and chairman of the Department of Family and Community Medicine from the Manila Doctors Hospital. You can participate in our discussion by calling our hotline. You can also follow us on Twitter, post on our Facebook page, or send us an email. Good evening, doctors. Welcome to the show.
Good evening.
Tonight, we'll talk about keeping our bodies healthy, free from diseases, at the same time smelling good through proper hygiene. Yes. So what is the best way to take care of our skin?
Well, I would say keeping your skin clean, okay? So